What if I told you there could be a ticking time bomb inside your body? When you can't see, you can't hear, you can't feel. Well, for thousands of people every single year, that is the reality of what's called an abdominal aortic aneurysm, or AAA for short. It's a silent threat that can grow for years, and honestly, understanding it is the only way to diffuse it. So, here's what we're going to cover. First, we'll look at the body's main pipeline, the aorta. Then, we'll get into what a AAA actually is. We'll talk about who's most at risk and how we can find this silent threat. From there, we'll get into when doctors step in, and we'll wrap up with what you can do to take control of your own health. All right, first things first. To really get a handle on the problem, you have to understand the real estate. So let's start with the absolute foundation of our circulatory system, the aorta. I want you to think of the aorta as the main superhighway for your blood. Seriously, it's this massive vessel, the biggest in your whole body, and its job is to take all that oxygen-rich blood from your heart and deliver it everywhere. Every organ, every muscle, every cell. It's under incredible pressure, and it's working for you 24/7, nonstop. So that's the ideal setup, right? But what happens when that super important high-pressure pipeline starts to develop a weak spot? What happens when the very thing that's supposed to keep us going starts to fail? Well, that question brings us right to our main event, the abdominal aortic aneurysm. It's a condition that's earned the nickname, the silent killer. And believe me, it's for a very, very good reason. Probably the easiest way to picture a AAA is to think about a weak spot on a car tire. You know that little bubble that can form on the sidewall? As the pressure builds inside, that weak area just balloons out. Well, that's exactly what happens in the aorta. A section of the artery wall gets weak, and the constant pressure of your blood flow makes it bulge outward. Now, in medical terms, not just any little bulge counts. It officially gets the title of aneurysm when the aorta gets wider than 3 centimeters, or when it swells up to be more than 1.5 times its normal size. That's really the magic number where doctors start paying extremely close attention. And here's what is so genuinely terrifying about this. For most people, the vast majority, there are absolutely no symptoms. Nothing. It just grows quietly, usually in the lower part of your abdomen, for years and years. But if that bulge ever bursts, it becomes an immediate life-or-death emergency. So this all leads to probably the most important question we can ask. Who is actually most at risk for the silent killer? Because while, yeah, it can happen to anyone, it is far more common in some pretty specific groups. Okay, so the biggest risk factors are pretty clear. The risk goes way up after you hit 60, and men are 4 to 5 times more likely to get one than women. If it runs in your family, that's a big one too. Same with things like high blood pressure or high cholesterol. But there is one factor that just towers above all the others: smoking. I mean, just look at that. That is staggering. Over 90% of people who get an abdominal aortic aneurysm are either current smokers or they used to smoke. It is the single most powerful link we have to this disease because it directly attacks and weakens the wall of the aorta. Okay, so if this thing is silent and the risks are so specific, how in the world do you find it before it's too late, before it becomes a catastrophe? Well, that's where screening and diagnosis come in. Let that sink in for a second. 3 out of 4. 3 out of 4 people with this potentially fatal condition have zero clue it's there. No pain, no weird feelings, nothing at all to warn them. This is exactly why it gets that silent killer name, and it's why being proactive about screening is just so, so important. So how are they usually found? Well, believe it or not, most of the time it's completely by accident. Someone's getting an MRI or a CT scan for something totally unrelated, and boom, there it is. The best way to find one on purpose, though, is with a special screening test, a simple, totally painless ultrasound of your abdomen. And sometimes, a doctor might even be able to feel a pulsing lump in your stomach during a checkup. Because that link to smoking is so ridiculously strong, there are actual official guidelines for this. In the US, the recommendation is a one-time screening for all men between 65 and 75 who have ever smoked. It's a simple step that can make all the difference. All right, so let's say they find one. What happens next? Do you immediately rush into the operating room? Well, actually, not always. It's this really careful balancing act between 2 main strategies: watchful waiting versus surgical repair. And really, it all boils down to one simple thing: size. See, for smaller aneurysms, anything under about 5.5 centimeters, the risk of it actually rupturing in a year is really low, less than 1%. So the plan is usually just to keep a close eye on it with regular ultrasounds. But once it gets bigger than 5.5 centimeters, the whole game changes. The risk of rupture jumps to 10% or even higher, and that's the point where surgery is almost always recommended. Now, when surgery is the right call, there are basically two ways to do it. You've got the traditional open repair, which is a major surgery with a big incision to go in and replace the weak part of the aorta. Then there's the more modern, much less invasive option called EVAR. With that one, they make tiny incisions in the groin and guide a special stent up to reinforce the aneurysm from the inside. And this right here, this is why finding it early is everything. When an aneurysm is found and it's repaired in a planned, scheduled surgery before it can rupture, it's incredibly successful. The mortality rate is just 1 to 6%. Your odds are fantastic. But if it isn't found, if it's just allowed to grow silently until it ruptures, the story is completely different. It's catastrophic. The mortality rate skyrockets to a devastating 85 to 90%. Most people don't even make it to the hospital. And this isn't just a number, it's the stark difference between life and death. It's the entire reason we're talking about this today. Okay, that was heavy, I know, but let's end this on a note of empowerment. Because knowing all of this, knowing the risks, isn't about being scared, it's about giving yourself the power to take control. So what can you actually do? Well, the good news is, these are the cornerstones of good heart health. Number one, by a long shot, is to stop smoking. If you smoke, quitting is the best thing you can do. Beyond that, it's about controlling your blood pressure and cholesterol, keeping a healthy weight, eating well, and, this is crucial, getting screened if you're in that high-risk group. So here's the bottom line, the main takeaway from all of this. Yes, an abdominal aortic aneurysm is a very serious threat, but it does not have to be a death sentence. Its absolute worst outcomes are almost entirely preventable. It just takes awareness, it takes screening, and it takes managing the condition proactively once you know it's there. You see, knowledge turns this silent threat into a manageable condition. The real power it has is in its silence. So the only question I have left is for you. If any of the things we've talked about today sound familiar, if you have those risk factors, maybe it's time to have that conversation with your doctor.